I am thrilled to be here today to be coming from the International AIDS Society Conference in Brisbane, in Australia right now. And we are delighted to be here to share the groundbreaking WHO's policy brief on viral suppression with all of you. This is really the biggest news of the conference for people living with HIV. That's something that can immediately be put into practice to change lives and policies that will eventually make it more equitable in the response, increase access for information and viral load testing that people with HIV need to stay healthy and not pass on HIV and have an amazing quality of life, accelerating us to the end of the epidemic. And we'll explain more of that to everybody shortly. But today we're going to start off with just a quick introduction to the brief, and then we'll go deeper into the brief with the author of the brief, who I'll introduce shortly. Then we'll have our panelists from the community talk about their thoughts on the brief and give some responses. Then we'll go into a Q&A, and then we'll wrap up and talk about next steps for how we can make sure that this groundbreaking brief gets put into action for those of us living with HIV. I should introduce myself. My name is Bruce Richmond. I'm the founding executive director of the Prevention Access Campaign, which launched the U=U campaign, which is behind me right here. This is a campaign that started as a grassroots movement. Now it's a global mandate. It's grown to over 1,000 partners in 105 countries. U=U is now required as a core standard of PEPFAR countries and a program essential of all Global Fund countries. So it's something that's super important. We're really proud to be a part of it. And this brief is essential for starting to make U=U a reality for all people. So I'll just quickly go into what are some of the key takeaways of the brief, and then we'll go deeper into it with the author of the brief, who I will introduce in just a moment. So just three things just you need to know for the brief, the three big takeaways. There's a lot more in the brief, but the main things are: first, the WHO is saying an undetectable viral load is zero risk. Now that's a big deal, because it's a huge deal. It's the first time that any global major public health institution, let alone the world's public health institution, is saying zero risk. That's very different from saying can't pass on or even untransmittable. Zero is zero. There's no ambiguity with zero. And that's really going to help so many of us who are out there advocating to get this message out. And then there's another category, the suppressed but detectable category of less than 1,000 copies per milliliter. And this is really important because this is a category that previously didn't have definition. So we know that under 200 copies per milliliter is untransmittable, but there was this gap for folks between 200 and 1,000 copies. And now the WHO is clarifying that there's almost zero or negligible risk in that category. Negligible is a tricky word, but it means don't worry about it. It's so insignificant, it's not worth taking into consideration. So that's really exciting for millions of people that are in that level of viral load or experiencing that level, where we can be able to give them more comfort. Now, the ultimate goal is to get to undetectable, as the author of the brief will mention shortly, but folks in this category should be able to know, am I going to pass on HIV to my partner? What are the chances? And we need to make that information clear to everyone. And then finally, the big deal is also that now, previously an undetectable viral load was measured by under 50 copies per milliliter, according to the WHO. Now, the WHO is saying, based on a systemic literature review and the science, that the undetectable viral load can be determined by any tests, so including more scalable dried blood spot tests. So now countries have more choices to confirm an undetectable viral load or any of the other categories of viral load, which the author will go into shortly. So those are really the takeaways. And now I'm really delighted to introduce you to the author of the brief. Let me just make sure she is here. I had the pleasure of working with her and in providing a lot of community support of input. And let me find your bio. Sorry, I'm such a disorganized person. So here it comes. So Dr. Lara Vojnov is the diagnostic advisor in the global HIV, hepatitis, and STI program at the World Health Organization. In this role, Lara leads normative guidance, development, and country support for HIV, hepatitis, and STI diagnostics. Prior to working at the WHO, she spent several years working with the ministries of health across sub-Saharan Africa and Asia as a senior scientist with the Clinton Health Access Initiative. Lara is my Shiro of the Year. Really thrilled to introduce you to her, and please take it away, Lara, and dive into this incredible brief. Over to you. Thank you.
Wonderful. Thank you, Bruce. You can hear me. You can see me okay. So far, so good.
Yes, we can.
Yes. Great. And hopefully now you can even see my slides.
Yes.
Thanks, Solange. Wonderful. So I really appreciate the opportunity to join you all today to talk to you about what we think is really an important message, an important policy brief for us. We've gotten a lot of excitement this week in Brisbane, and we're really hopeful that this is just the start of something really, really great. So today I want to talk about a policy brief that we launched earlier this week entitled The Role of HIV Viral Suppression in Improving Individual Health and Reducing Transmission. So in 2020, we started to, and we do this relatively routinely, where we want to reflect on the current guidelines we have, on the current suggestions and guidance that we provide, and understand whether it's still relevant. And in 2020, we took a nice little deep dive into our treatment monitoring algorithm and wanted to think about a few different things. One of those pieces was we commissioned a series of systematic reviews to really try to understand lower limits or lower levels of viremia and how they affected and impacted both individual health and transmission. One of those reviews has been published in The Lancet, and it was published in The Lancet just about 5 days ago now, and happy to share with all of you. I've included the reference below. The Lancet systematic review looked at the risk of sexual transmission when people living with HIV have lower viral loads. This systematic review included about 8 studies and over 7,700 serodiscordant couples. 3 of the studies within this systematic review showed no HIV transmission when the person living with HIV had a viral load less than 200 copies per ml. And this included the studies such as the HPTN 052 that you likely know well. In fact, most of the transmission events that were observed across those 3 studies had a viral load of well above 30,000 copies per ml. There are an additional 4 prospective studies where we saw over 300 transmission events, but none were in people living with HIV who were considered stably suppressed on ART. Amongst all the studies, and keep in mind again, this is 7,700 serodiscordant couples, there were 2 potential cases of transmission when the person living with HIV's most recent viral load was less than 1,000 copies per ml. In one case, it was about 700 copies per ml, and in another case, it was about 850 copies per ml. However, and I really want to note this and keep this in mind for everyone, both of those cases, the viral load test was taken more than 50 days before the transmission event, which to us and an entire expert consultation felt that really cast significant doubt as to whether those were the true viral loads of the people living with HIV at the time of transmission. And it's likely, and the group felt very likely, that the viral load of the index case was likely higher than 1,000 copies per ml by the transmission event. Unfortunately, to date, we haven't seen or identified a lot of studies that have looked at HIV transmission through the sharing of undirected drug use equipment. Within our processes within WHO, we obviously rely heavily on evidence. And so the systematic review was a key piece of evidence that we really wanted to think about. But within the efforts, we convened a group of experts to think about the benefits of the evidence, any potential harms that could come of them. We wanted to also think about the impact of some of the positive messaging that we thought could come out of the evidence around the systematic reviews, and reflect on the ongoing challenges that people living with HIV have with regards to stigma, discrimination, and criminalization. So what we did within those expert consultations was we reflected on the evidence and all of these additional components, and then thought about how could we formulate some guidance and key messages across the spectrum of the HIV response. So that included civil society, it included health providers, clinicians, academics, policymakers, implementing entities, et cetera, to develop a message and a policy brief that could be well understood across the board, but also include some of the key messages that were evidence-based. And that is the result of the policy brief, in fact, is a result of that process. Some of the key pieces and the overarching theme of the policy brief is really about thinking about clear celebratory messaging for people living with HIV. And we thought about that by providing or suggesting 3 categories of viral load levels. The first category in green at the top is an undetectable viral load. We're redefining that now to mean a viral load that's not detected by the test or sample type used. That means there's no measurable virus. For people living with HIV who have an undetectable viral load, we are very comfortable, based on the Lancet review, to say that they have 0 risk of transmission to their sexual partners and minimal risk of mother-to-child transmission. Again, I think we think it's really important to clarify and be clear that people living with HIV who have an undetectable viral load have 0 risk of transmission to their sexual partner. The next category is the suppressed category, and we define this as being detected, but equal to or less than 1,000 copies per ml. There's some virus replicating and present. It could be due to missing doses, and of course, that's potentially an adherence issue, but also potentially a stockout issue, a number of issues that could happen within the system to prevent people living with HIV to continue their medication, recent treatment initiation, or drug resistance. When a person living with HIV has a suppressed viral load, we are saying that they have almost 0 or negligible risk of transmission to their sexual partners. Then finally, there's the unsuppressed category. That means you have a viral load that's greater than 1,000 copies per ml. There's significant virus replicating and present, again, could be due to missing doses, recent treatment initiation, or drug resistance. People living with HIV who have an unsuppressed viral load are at increased risk of falling ill and or passing the virus on to their sexual partners or children. I want to note that the only reason that the suppressed category is in the yellow or amber or cautionary color has nothing to do with the transmission risk and only to do with the fact that we don't currently know what the risk of having a suppressed viral load is on individual health of people living with HIV, particularly as countries are significantly and quickly scaling up optimized triple dolutegravir-based treatment. There's still an evidence gap in understanding whether that means anything for their own individual health. We want to clarify and make it very bold and clear that the ultimate goal, of course, of all people living with HIV is to reach and sustain an undetectable viral load, but at the same time really highlight that people living with HIV who have an undetectable or a suppressed viral load should be celebrated for reaching those pieces, understand, and be provided with the information on their almost 0 risk for those who have a suppressed viral load or 0 risk of transmission for those who have an undetectable viral load to their sexual partner. Another key piece that we felt was important to include is particularly when we think about some of the stigma, discrimination, and criminalization of people living with HIV, is to highlight that really the majority of people living with HIV are not at risk of sexually transmitting the virus. And this is from work with Jeff Eaton and his group that was published earlier this year at CROI that looked at the proportions from the FIA studies of people living with HIV who are on ART and have an undetectable or suppressed viral load. And you'll see from this graph that over 70% of people living with HIV have an undetectable viral load or a suppressed viral load, meaning that they are not transmitting the virus onto their sexual partners. The majority or all of the transmissions that are occurring are from people living with HIV who are undiagnosed, who are diagnosed but untreated, or unsuppressed. And so ideally, some of the considerations that we'd be thinking about as an HIV response, of course, would be continuing to provide PrEP, but also trying to identify people living with HIV who remain undiagnosed and link them to optimal and keep them into antiretroviral therapy programs. There are two additional considerations that we wanted to talk about. Number one, I think we all know that HIV viral load test results can be a real motivation for adhering to treatment and achieving the ultimate goal of being undetectable. But the problem is, if people don't have access to viral load testing, they may not know or they cannot know that they have an undetectable viral load and can live their life knowing that they're at zero risk of transmitting HIV sexually. And so to link with that, we're really encouraging that current WHO pre-qualified tests, including point of care and alternative sample types such as dried blood spots, can support the goals of treatment programs to accurately measure and report viral load results as unsuppressed, suppressed, and undetectable. This shouldn't be a plasma versus DBS conversation. This should be encouraging and making sure that all people living with HIV have access to viral load testing, whether it's through a plasma-based test, dried blood spot, or any other WHO pre-qualified assay. It can provide the results and the knowledge and the information that is critical, or we feel it's critical, that we're portraying within this policy brief. Now, you might ask the question, but how can we use dried blood spots? Does this really work when we think about having an undetectable result or a suppressed result? There are a number of different outputs that viral load technologies can provide. Regardless as to what the technology is or the sample type, they can all provide a not detected result. And they all, in fact, do provide a not detected result. And again, that links to the undetectable. It means they couldn't find any virus in the sample. For dried blood spots that perhaps might have what we consider a lower limit of detection that's a bit higher than plasma, that doesn't mean that it can't measure something that's below that limit of detection. In fact, oftentimes it does. But for regulatory reasons, it just won't give you the actual number, but it's not going to say you're not detected. It's not going to give you a really high number incorrectly. It's effectively just going to say, you have some virus. We can't give you the number, but it's in that suppressed category. And we feel like that's really important for people to know, that even with higher limits of detection for certain assays or sample types, that doesn't mean that it can't measure below. And the reason why this is important is we've done a systematic review that's come out in PLOS Medicine to show that even with that, what some people would consider limitation of a higher limit of detection, it still accurately measures when someone has an undetectable or suppressed or an unsuppressed viral load. And so we really want to encourage countries and others to think about all of these different alternative options that you can utilize to be able to provide viral load testing to everyone, and therefore giving everyone and empowering all people living with HIV with the information of what their viral load is and how that relates to how they can live their life and what their transmission risks are. And then I just want to summarize quickly with viral suppression obviously remains a key global public health and individual goal. I think we all know well the 95, 95, 95 targets. Of course, in order to start thinking about or continue to think about reducing transmissions, we need more people to know their HIV status, linking them to optimal ART care and retaining them. And then, of course, ensuring that 95% of people on ART have viral suppression. When we think about viral suppression, it's not just about undetectable. Ideally, we'd be counting both people living with HIV who have an undetectable and a suppressed viral load. I just want to pause here and just acknowledge all of the experts that joined our consultation. Again, this came from both civil society, researchers, policymakers, implementing entities, et cetera, really contributed significantly to getting this policy brief where it is. And then we have a number of people, both from WHO, IAS, and other spaces, who supported finalization of the brief and also supported translation. Shortly, we should be linking online and the website is below where you can find the policy brief. We've translated it into French, Spanish, Portuguese, and Russian to be able to hopefully support the message getting out more widely. And then we're always open and interested in additional translations as you see fit and as you think there's need, and can link with our regional and country offices to do so beyond our 6 UN official languages. So Bruce, I think I will pause there and hand it back to you.
Thank you so much, Laura. And I really want to just acknowledge and pay tribute to Lara and her colleagues at the WHO. This week marks 5 years since the WHO endorsed U equals U at the World AIDS Conference in Amsterdam. So the WHO has been behind and pioneer with treatment as prevention for many, many years. And the fact that this agency has stepped up to say 0 risk, which is fairly rare in science for anyone to say 0 risk is a really bold move that is going to change a lot of lives. So thank you so much, Lara. Really thrilled to introduce my colleagues now. So if our panelists could come forward, I will introduce each of you. We have, gosh, it always takes me a little bit of time to find my, my notes. Okay, so we have Florence Riako Anam, who is the co-executive director at GNP, and she is passionate about youth leadership, the health, rights, and well-being of people living with HIV, driving tireless advocacy work to empower individuals regardless of their background and ensure their access to comprehensive SR, HR, and HIV services. Her leadership is instrumental in fostering inclusivity and affecting positive change within the global HIV community. And we also have, is everybody on the screen? All the panelists? I can't tell. I think so, right? Yes, and so we also have Mr. Tung, Doan, who is a young gay man and LGBTI and HIV activist in Vietnam. He is currently the programs manager at the global network of young people living with HIV, Y+ Global, and a technical advisor for Lighthouse, a community-led organization in Vietnam. Tung has over 13 years of experience working in community development, communities health and rights advocacy, HIV/AIDS response program implementation, and stigma reduction at national, regional, and global levels. We also have Solange, Baptiste, who is the executive director of the International Treatment Preparedness Coalition, ITPC Global. Solange has over 17 years of global program management and advocacy experience and specializes in monitoring and evaluation. She has a depth of knowledge in social epidemiology, program design, and community systems strengthening in the developing world through her work on USAID, PEPFAR, health and development, other bilateral and multi-country initiatives across Latin America, the EECA countries, and Africa and Asia. So thanks everyone for being here. We're going to go around and ask for your feedback on the brief. What were your perceptions and from your unique perspectives and the communities that you serve? So we'd love to start first with Florence. What were your thoughts on the brief? Look forward to hearing from you.
I will respond to the question you asked me, which is around my thoughts around viral load access, importance of guidance on clear messaging, and including how the clear language in the brief can support in ending HIV transmission more broadly. I'm excited to join you all and scream, say zero. It's a shame I'm not in Brisbane with you, but I will keep saying these words and they give me so much joy. People living with HIV continue to experience profound levels of stigma, discrimination, and criminalization because of the language of risk of transmission. Words shape our experiences. They define who we are. The language of risks around the lives of people living with HIV, and particularly the bodies of women living with HIV, have reinforced stigma, oppression, violence, and discrimination. What this has led to and continues to lead to is shame and continued barriers to accessing HIV prevention and treatment information and tools that people living with HIV need to live quality lives and prevent transmission to partners and children. We heard from Lara right now with clarity that gives me so much joy that this WHO viral load policy brief recommends the use of zero risk by health providers describing sexual transmission risk when undetectable and taking treatment as prescribed by the doctor, and minimal risk from mother to child. The WHO is not only reaffirming the language that we have been speaking for eons, undetectable equals untransmittable, but they're also saying zero risk. This is the world's largest public health institution. This is a big deal. I echo your words, Bruce. It's stronger language than U equals U. And we must begin to use this language to motivate amongst us how we can get more people on treatment, get people adherent to treatment, and live quality lives. We all know that language matters. This global credibility of WHO and the universal clarity of zero risk will help communities break down the persistent hesitancy we have experienced in informing people more confidently and clearly about undetectable equals untransmittable, U equals U, and its evident benefits. The global credibility is how communities will be able to address social barriers to accessing treatment and prevention tools. We now have more force and credibility of science with this policy for defense in criminal proceedings and a scientific foundation for the modernization of criminalization laws against people living with HIV. In many countries, laws criminalizing HIV transmission, exposure, and non-disclosure have been introduced. These laws are increasing despite being ineffective, discriminatory, and obstructive to HIV prevention, treatment, and care. Many fail to acknowledge that HIV is no longer a death sentence due to effective treatment, which eliminates the risk of transmission. Zero risk. As at GNP+, we have, with all the key population networks, started the Not a Criminal campaign that seeks to advocate for the removal of draconian laws, including those that criminalize people living with HIV. The viral load policy, if operationalized properly, can lead to massive scale-up of viral load testing. Millions of people are without access because countries have limited diagnostic tools. Countries need both plasma and alternative sample tools like the dried blood that Lara was talking about and point-of-care testing to expand access to viral load testing, including for pregnant and breastfeeding women living with HIV. All actors in the HIV sector need to reach as many of our community with this message on zero risk, to motivate adherence, motivate safe and healthy pregnancy and breastfeeding experiences, and motivate uptake of viral load testing. Community-led, updated treatment literacy interventions, health worker trainings, and briefings are critical in this time, particularly now when the momentum is still high. This must be complemented by country plans and resources to ensure treatment and viral load testing is accessible for all. Everyone wins when people living with HIV have quality and healthy lives. We all know, however, that for all of us to best benefit from the opportunities of the zero risk, all of us must work to end the health inequalities that limit many people living with HIV from accessing treatment, and many who do not access viral load testing or have no idea what their results are after they get tested. All people living with HIV must be able to confidently own the language of U equals U and zero risk, and confidently shout, say zero. Thank you, and back to you, Bruce.
Florence, thank you so much. That's so inspiring. And now I would love to introduce Tung. Could you please take this virtual stage? Thank you. Over to you.
Thank you very much, Brooks. Thanks, everyone. Thank you very much for having me here today to celebrate this important milestone. not only as a young person, but also to representing the voice of countless other around the world who are affected by and living with HIV. I must state clearly that viral load access is critical, particularly for all young people living with HIV. Viral load testing is more than just medical procedure. It is a lifeline that allows us to track the effectiveness of our treatment and take control of our health. However, access alone is not enough. For sure, we also require guidance on clear messaging from a youth perspective. Medical terminology can be confusing and complex concepts can be difficult to understand, especially for young people. That is why it is significant to communicate with young people in simple, relatable terms that reflect our experience. In this regard, you could use concept proof to be a useful tool. And saying zero risk is significant. It is not only inspiring us, but also groundbreaking in terms of removing the stigma associated with HIV. We can raise awareness about important viral tests, and you could use among people who are affected and living with HIV to make sure that we can make informed decisions about accessing to the services in a timely manner, and treatment plans and protecting our health, allowing us to live full and healthy life. We also need to educate health providers, policymakers, and the general public through advocacy and education. We have the opportunity to challenge the stereotypes that have afflicted our community for far too long. And by doing so, we will create an environment in which all young people living with HIV have access to quality healthcare and social supports as a right, not a privilege. But our adventure does not end there. We have to also defend our rights to participate in decision-making processes that affect to our life. And we are not simply passive recipients of care, but we are active change agent. Intervention and strategy must take into account for the unique perspective, needs, and aspiration of young people. And finally, remember that the fight against HIV about more than just medicine and science. It is also about the equality, understanding, and compassion. We make a real difference in the life of those living with HIV if we work together as an united force of young advocates, and we pave the way for a brighter future by championing viral load access and clear messaging, particularly around you could use. We have got powerful tool and enough by mouth commitments. And this is now time to take real action that led by young people to create an HIV-free generation. So that is what I thought and my reflection from the WHO new brief, policy brief. Thank you, Brooke.
Thank you so much, Tung. And it is time to take real action, and we're excited to be working with you. I'm going to pass this over now to Solange.
Thank you very much. I don't think I have much to add to what has already been said, so I will be as brief as possible. I'm happy to see that the brief is brief. Let's start with that. We have too many long papers that are complicated, and I think that this brief is very well written. It's clear with simple language, and the messaging is as plain as day, and the importance of saying zero, as Florence said, is really critical. It's all about improving the health and quality of life for people living with HIV. And I think it was you, Bruce, who said, that there is no more important news at this conference that is immediately impactful for people living with HIV. So this is truly groundbreaking, and I'm excited, I'm thrilled. My excitement is only tempered by my own understanding of the realities on the ground of how implementation actually takes place at a country level, at a site level, at a clinic. And we're well aware that even the best policies without, adequate dissemination, political will, buy-in from communities, healthcare providers, across funders, across donors, that, implementation gaps, without those things, implementation gaps will be guaranteed. So we need to be sure that we are speaking with one voice and really paying attention to what this looks like in terms of operationalization. I think I worry about the policy implementation gap, but I think we can overcome that once we have the kind of excitement and understanding that has been generated from the ground up from people who understand the implications for their own lives and be able to, generate that demand that is needed for this groundbreaking brief that gives clear explanation of what their results mean. I also just, the things that come to mind are around, obviously, access to viral load testing, finally, no more debate between DBS versus plasma. We just need everything that can help people know what's going on with the medicine that they've been taking and if it's working in their bodies. So we are clear now what those results should mean, which means then that we need to make sure that people have access to viral load testing and the results, and those results then need to actually come in time for them to make decisions with their clinician about their own health. So I'll stop there and maybe let us move more into discussion, but I am excited and truly thrilled by what this brief has to say. Thanks.
Thanks so much, Solange. I'm going to bring Lara back so that everybody's on screen and we can have some interaction and some questions. First, Lara, I wanted to ask you. So there's the agencies have different definitions of viral suppression. PEPFAR's definition of viral suppression is less than 50 copies per milliliter, and the CDC in the United States defines it as under 200. So why is there this discrepancy, and what can be done about that?
So it's a good question. I mean, why is there discrepancy? It could be a million different reasons, but I think the most important thing is the second part of your question is what can we do about it? I think from our end, it's let's clarify these definitions, let's standardize it, let's just make it as clear as what we've tried to do in the policy brief, so that, those who have an undetectable viral load, it's very clear they have zero risk. And then there's the category around the suppressed piece where they have it detected, but less than 1,000 copies per ml, and they have almost zero risk. And I think, from this brief, we can now sit down with PEPFAR, with Global Fund, and with others, and really streamline those definitions across the board. I don't suspect that that'll be that challenging of a conversation, frankly, given, I think, the reception that we've had around this. And I really, for a second, want to also take the time to acknowledge and appreciate a number of you who are joining this call, Solange, Florence, Bruce, all of you who have contributed to this policy brief. I think we haven't always engaged as well in this space, and I think the voices of civil society here were really critical in helping us to craft and think about what the key needs were in terms of developing this policy brief. And just want to take that minute for a second to thank you all for doing that.
Thank you, Lara. Thanks for that. And I think I noticed, I don't know if Tung is on the video. I just got a message just to make sure that he's available here too. Okay, great. So then a question for Florence. So why is there still resistance to telling people with HIV the truth about our bodies? We know that when people with HIV are informed by their providers about U equals U, people living with HIV have better health outcomes, better sexual health, mental health, overall health, adherence, viral suppression rates, quality of life, comfort sharing status, with all these benefits. So why isn't everyone being informed, and what can we do so that, as you said earlier, that this information isn't privileged?
I think one critical thing has been, there's not been actual clarity on how much zero the risk is with U equals U. So undetectable equals transmittable, but the previous guidelines didn't quite give, I think, particularly communities, that confidence that we are getting now with this updated viral load brief. So this is clear. We know it's zero risk. Language does really matter. And when there is opportunities to water down what actually is with the language that is presented, particularly in policies, countries and people usually use that to, stamp on their biases and stamp on whatever aspects or prejudices they have against people living with HIV. So I think one of the greatest challenges and the pushback has been the concern on the confidence of how much untransmittable is when one is undetectable, because that was not very clear. It is clear now. There's also been a lot of confusion among certain populations in communities around the language of undetectable and suppressed. So what's undetectable, what's suppressed? And I think this viral load makes that very, very clear. And also, I loved how Lara in her presentation stops to actually clarify that on the suppressed, the actual amber button is not necessarily on risk of transmission, but it's actually on lack of understanding of what it means for quality of life. So these kind of conversations have not been existing. Then for certain populations like women and girls, and particularly pregnant and breastfeeding women, there's not been enough information for people to just own it and be like, oh, so I can breastfeed my child and the transmission is there or not there, but now we know there's minimal risk. So I think the language has shifted now to give us more confidence. The clear celebratory language is not only celebratory, but it also is empowering. And we need to understand that the language of you equals you is really empowering, not only for motivating treatment, adherence, etc., but for changing the narrative around risks for our bodies and our lives. So that means for us empowering ourselves as people living with HIV in how we look at ourselves and how we value ourselves. And so this is an opportunity right now that I really do hope we will get support from partners, from WHO to take on to the ground in different languages that we best understand, so that as many of us as possible find the confidence we need to uptake and adhere to treatment. Thanks.
Absolutely. Thank you, Florence. And Solange, so taking this from the sort of the country and government level down to what can communities and healthcare providers do to make this a reality?
You know, I've been thinking about this. Obviously, I've tried to prepare, but now I'm thinking about something else. I'll just say that, you know, what we end up having is sometimes we have now awareness of people living with HIV, recipients of care, having higher awareness than the actual healthcare provider, the sister, the nurse that is in a rural area, or even in the urban setting at a clinic. And you have these very interesting power dynamics where they know what the policy brief is, or they're on this webinar and they're going to spread the word. And they're now having to navigate this power dynamic with a healthcare provider who is supposedly, you know, telling them what they should do or not do with their bodies. So I think it's really an interesting thing now to see how this will play out at country level and at a very local level. Our job is to make sure the message is spread and it's spread without distortion. So any media picking this up, anybody telling their friends, they're not going to dilute it, as Florence said, and put their own stamp of contamination on it. It's really just what it says. It says zero risk, and it has the amber. There's very clear slides from Lara that we can take up and we can try to change into different languages and make sure that it's messaging that resonates with communities and it's tailored to their context. Say it in words that they understand and explain and take time to break down the messaging. From a systems and a government perspective, I think the role of communities are also to monitor what's happening in terms of viral load access. We at ITPC have been doing work for community-led monitoring around what's happening at the lab, in particular with viral load testing. So when people get their viral load tests done, how many of them actually get their results and how many of them get the results with an explanation of what the results mean. The drop-off is wildly incredible. And so for this to work, we need to be able to have messaging that goes all the way through so that people understand what their results mean so that they can make decisions that help them to live healthy and quality lives. And I do just want to say, just because it's on the top of my mind, is like the messaging also cannot compete with CD4 testing. So we used to have a lot of confusion. One minute you didn't need CD4, next minute you needed CD4, now you need both. Now we're thinking about advanced HIV disease, which is the same word for AIDS. What does it all mean? And so we need to have clear messaging that combines all of this so that a person living with HIV knows what they should be asking for at any point of time in terms of their health journey. Yeah, I'll pause there. Thanks.
Thank you, Solange. And Tung, AIDS is still the leading cause of death among young people in Africa. This is shocking, and the leading cause of death of women in Africa. But specifically, let's focus on young people being left behind. How could this policy brief end up addressing this unacceptable current reality? How does that how is it put into practice to help young people in the response?
Thank you very much for bringing the light an urgent and unacceptable reality. Young people are being left behind, and AIDS remains the leading cause of death among the African youth. But let us not be discouraged by these challenges. We should see it as an opportunity for collective action and change. The information presented in this policy brief is a game changer for, I think, 3 key points that can drive impactful action. WHO recommendation to use zero risk is really important. The endorsement of this is not only helps to strengthen the confidence of people living with HIV, but also globally influencing health entity lens credibility, allowing healthcare professionals to confidently communicate about you could use zero risk without hesitation. The policy brief also highlights the tremendous potential for scaling up viral testing, utilizing various methods, including more scalable dry blood spots, will increase accessibility and allow countries to confirm viral categories more effectively. And it is also important entry point for young people to gain confidence in accessing early testing and treatment services, particularly those who continue to refuse services due to stigma and discrimination. In addition to changing social attitudes and confronting social prejudice and stigma and discrimination, with the implementation of this policy brief, millions of people, young people living with HIV will be able to live without fear, confidently embracing love, relationship, and family planning. And this is an enormous leap forwards in the speeding the end of HIV and AIDS. So we, Global Network of Young People living with HIV, we will certainly unpack this policy brief to a youth-friendly language materials to ensure that young people can fully understand and also to have better and adequate information about this, and use this important scientific information to share and educate to, service provider, healthcare provider, to make sure that they communicate adequately and, sufficiently with the community, and also to improve the quality of services as well, and to advocate for the policy, to better policy, make sure that everybody can access to the viral testing, particular for young people. And I think the last words we call for all of us to act together and stronger now to express, to say zero, and also to spread the message and make sure that community can access to this important information, and also advocate for a better policy to make sure that everybody can access to viral test.
Thank you, Tung, and I think that, and thanks to all the panelists for answering the questions. We're going to have a couple of minutes to answer questions from the audience, if there are any. There actually were there was one question that really has kind of been already answered by the panelists, is how are we going to get this out, outside of the HIV field? How are we going to get this to the broader, public? And, and I think folks were saying that this is really up to all of us as our agencies, agencies I'm with Prevention Access Campaign, we have GNP, we have Y+, we have ITPC Global, and then we have the Viral Load Testing Access Coalition that we're all members of, and have founded this coalition together to really take, to make sure viral load testing access is accessible to all, and this brief is really our first really big dive in together, and we can translate this brief for the communities that we serve in the various ways. But if there's any questions, please put them in the question and answer section. Arda made a really good comment that he will be translating this into Turkish and sending it to relevant people in his country. And I think, you know, all of us of advocates who are on this call and through our vast networks that all of us have an opportunity to share this brief and really get it to stakeholders at home. Solange, you had a question or an answer, go for it.
It was just a small comment. I just figured that we should make sure that say yes and the green, amber, red is not used to stigmatize folks who are not achieving those colors or those status in terms of their viral load testing results, because I think we've learned enough across the years to kind of think as much as we can ahead of the unintended consequences of some of the most noble actions that we have in the HIV space. And I think we just need to put that out there. And I think it's top of mind in some of the conversations we've had before, but just wanted to say it in this webinar that we want to make sure that this is set as a continuous journey of health. And this is not to be stigmatizing someone who has not achieved a green light in terms of their results. If only it was that simple, you get your results with colors, but yeah.
No, absolutely. And I think that when we launched the U=U campaign, a really important part of this is to, when we speak clearly, confidently, consistently about it, but also consciously to understand that many people are not able to get to an undetectable viral load sometimes by choice, but very often by circumstances outside of their control, and that we need to acknowledge that and also make sure that we're working and in our advocacy to see what those barriers might be. How can we remove those barriers so that U=U or getting to a suppressed but detectable viral load can be a reality for everyone. And we can actually use this science in our advocacy for access to treatment. So if there are not any other questions, maybe now what we can do is we'll really talk about next steps. So the groups here that you see, as well as other civil society organizations have formed, as I mentioned earlier, Viral Load Testing Access Coalition. And part of what we're doing is looking at how to take this brief and communicate this to the communities that we serve and in the countries where we're working, and making sure folks, as I think Solange had said earlier, not put their contamination on it, or as Florence was saying, to change the message or dilute the message. And there's so many different audiences that we need to reach. We need to reach first and foremost people living with HIV with this great news. I mean, we're an incredible activist force. We've been rising up around the world around different issues, whether U=U or criminalization, or and we need to reach healthcare professionals. We need to reach ministries of health so they know how and push on changing policies. We need to make sure that the global agencies like PEPFAR and the Global Fund are aware of this brief and the implications for viral load testing around the brief. And we all have an opportunity to create tools from this brief, communication tools to, how do you, communicating zero is pretty easy. Zero is zero in every language. But creating tools to communicate almost zero and negligible risk, right? There's a whole other area and millions of people that need to be informed about this next category. And so I hope organizations that are on here will start developing proposals and seeking funding to do these projects and developing consortiums. We're working now with a couple of consortiums to get this, to develop tools, to develop a cartoon that should be coming up soon. And then we really need to look at integrating this into policy now that we have zero for the undetectable level and negligible in 1,000 and below, let's look at integrating this into our criminalization movement. And negligible holds a lot of weight in court because it means it's so low, it's insignificant. So don't worry about it. So throw it out of court, you know, but then, you know, really make sure that you know, we're looking at, as Solange was saying, the implementation process on the ground, turnaround time, and training folks on how to communicate the results. So there's a lot happening here. We're aiming towards building the movement around this and launching around ICASA. So building a real movement around viral load testing. And I think it would be really important to connect with any of us on this call. We'll be sending out the slides after this and contact information. We're all members of the Viral Load Testing Access Coalition. And, you know, our goal is to make sure that viral load testing is accessible, affordable, and or free for everyone, and equitable. And we will be sure to give you our, you know, to engage you. So this is a movement. It's gonna be many years before this brief is going to be fully operationalized around the world. But right now, what we can do is make sure people know zero risk. That's pretty easy to get across. Zero risk, say zero, share it with the communities that you serve, and please join us as we put this brief into operation. I think we're at the end of the session. That was a really fast hour. Thank you to these incredible colleagues and friends on this call. This is just beginning, and thanks so much for the attendees. We look forward to more webinars and going deeper into all more aspects of this phenomenal brief. Thanks, everybody.
Thank you.
And thank you all.
Thank you so much.